Thank you, Dr. Larney. Mr. Johns, please, for 2.5 minutes.
Well, thank you. I'm going to go back to Dr. Wiseman. Dr. Wiseman, I really appreciate you talking about the comparables with COVID. I mean, the federal government spent less than 1% responding to the toxic drug crisis than to COVID. We've now lost more people to the toxic drug crisis than COVID, I believe. We've seen death rates in neighboring provinces. In Alberta, they just had a record amount of deaths last year. Alaska, a neighboring state, 45% increase in deaths, now a higher death rate than British Columbia. Baltimore, it's 5 times that of British Columbia. All places without harm reduction, pretty much no safe supply, no decriminalization. I guess what I'm asking is maybe you can speak about your earlier comment about the impact of politicization of this crisis and the impact that's having. And also, I was in Portugal last year, and they talked about the fact that it was experts that led their response, not politicians, and the politicians got out of the way. Can you talk about the role politicians should be playing and experts, and how we can move forward with less politicization?
Thank you for that question. I think as a way of responding, I will say one of the things that we have observed in British Columbia is that a lot of misinformation is being spread in the public realm around the toxic drug crisis and interventions directed at trying to save lives. So that misinformation is really harmful and has the potential, should, for example, supervised consumption sites be closed, as mentioned by Dr. Larney, the effects of that would be devastating. We at First Nations Health Authority are in support of a full spectrum of prevention, harm reduction, detox, treatment and recovery, and aftercare. And I think what happens with the spread of misinformation for purposes other than for politicization purposes, is it leads people, it increases stigma, for example. People using the term drug dens to describe supervised consumption sites is really abhorrent. These supervised consumption sites, the body of evidence supporting lives saved is very strong. And for example, I'll say we've used the broken leg analogy already in this committee. We have centers that provide dialysis, for example, to people in kidney failure, so they don't have to travel long distances. We don't call those dialysis drug dens. We do because of the stigma against mental illness and people who use substances.
Thank you, Dr.
And I
Wyman.
think that has not proven to be very helpful, has been harmful.